Does your blood pressure spike when you visit a doctor in a hospital environment where your blood pressure tends to be slightly higher than normal? One of the reasons their blood pressure has this slightly higher reading is because of the environment. It's very common for someone who have their blood pressure measured in a clinic, in a hospital environment. The reading tends to be slightly higher than the normal. So it's best to do all your blood pressure reading in a safe place, like for example in your home. You can do an average. Let's say if you take your blood pressure 3 times daily, maybe in 2 to 3 days. So you have this average reading, and let your doctors know that this is your blood pressure done in your home for the past 3 days, and this is the average readings. The doctor may advise you to go for another reading, but you can have this baseline blood pressure comparing to the one you do inside the clinic. Another reason why your blood pressure is higher is because you might be fighting an active infection. There might be something wrong, or you may be having a sleepless night the day before. When you are someone who having this sleep deficiency, your blood pressure will eventually goes up also. It could be also food sensitivity. Okay, you might be consuming a food that increase your this pulse rate, your heartbeat. That's why your blood pressure will be increased also. I've included this food sensitivity pulse test inside my description box below. It's free for you to download. So you can actually do a test before you consuming a new food, a new ingredient. If your pulse rate increase within 5 minutes of your injections, you know that this food is not meant to be eaten. Your body is telling you that this is not good for you. It doesn't mean that the food you're consuming that increase your this pulse rate is very fatal for you. It just means that when you consume all this food, you might not have sufficient enzymes to break it down. Okay. Your immune system in your gut is reacting to it. That's why your pulse rate and your heart rate is increased, because they are telling you something, this is not good. One of the simplest example is when you consume a very spicy food. Okay, you consume a spicy food, the spicy level is not the level you can actually tolerate. Okay, so when you consume this, within minutes you will sweat profusely. Okay, some parts of your mouth, your tongue can become numb. You lose a little bit of this taste bud. Okay, your heart rate will increase, your pulse rate will increase, so does your blood pressure. If you are someone who have allergic reaction to a certain part of food, I think you will know this experience. I heard a lot of my friends, even my parents, when they visit for their annual checkup, they were advised to take less salty food, less spicy food. They might even advise you to take less coffee, less tea, caffeinated drinks, all these caffeinated drinks. They will advise you to drink more water, increase your water intake, your hydration. The second advice that most doctors will give is to ask you to go for exercise, to exercise more frequently. The third advice they will give, most probably, is to reduce your stress. The stress is a very, very wide term. A lot of people doesn't realize that this stress, what does stress actually means? For me, there's a lot. Stress can mean coming from your friends, your peer pressure, your family, your financial stress, your work stress, your environmental stress. There's also one which a lot of people a lot of people overlook, is this ergonomic. If you're someone sitting on a chair 8 to 10 hours daily, looking at your laptop and your mouse and your sitting posture, all this will create stress to your body. This is physical stress, ergonomic. And if you are someone who have this very, very high blood pressure, which belongs to maybe like 170, 180 to 200, when you reach to this level, most of the time the doctors will prescribe you some form of medications to try to bring this level down. Do you agree all this advice which most of the conventional doctors will actually give you? It's very rare to find some practitioners who actually suggest you to go for certain tests. One of it is to test your minerals, whether you are deficient in certain type of minerals or you have excess in certain type of them. If you're lucky enough to find these practitioners that actually suggest you all these special type of testings, they belong to this holistic and functional health space. You want someone who actually look at the whole person, look at you, the whole person, together with the lab test. Not just treating the paper. They might order a lab test like the mineral test and they found out that you have low potassium. And they're just suggesting you to go for potassium supplements. They are just treating the paper. So it's best to have someone who can look at you as a whole person, to look at your medical history, your lifestyle behavior, then look at the test result, and to come up with a very tailored, individualized protocol. The rise of this high blood pressure could be also the environment, your work environment or your home environment. Okay, there could be a possible mold. There'll be mold inside your home, which happens to me, and I didn't mention in my previous video. It could be some other underlying issues. The most common one will be this insulin resistance, which leads to diabetes. And most of the diabetes or obese people, they also having this sleep apnea. When you're having this sleep apnea, you'll be breathing through your mouth. Okay. Someone who breathes through their mouth and doesn't breathe through their nose will have a very low level of nitric oxide. It's very common to have, you brush your teeth, then you floss your teeth, you also use this mouthwash. This mouthwash is so potent that can basically kill all your bacteria, all the good and bad bacteria inside our mouth. So when you kill all these bacteria inside our mouth, you can't convert nitrates into nitrites, then into nitric oxide. Nitric oxide is natural vasodilator. So you actually dilate your blood vessels. When your blood vessel is being dilated, you have a smooth flow of this blood. Your blood pressure will eventually go down. Someone who is having this high blood pressure usually doesn't just have these symptoms. Okay, it doesn't just occur solo as a standalone. They usually comes with other symptoms, which they might or might not notice. And if you are someone who actually do these genetic testings, you will notice that this NOS genes, they doesn't function very optimally, maybe function at a 50% rate. So the production of this nitric oxide is low. Then you will cause this high blood pressure to rise. I will talk more on these genetic testings in a future video. And this NOS genes is just one of it. And how you affect this nitric oxide productions, and then you will lead to this increase or decrease of this high blood pressure. Okay, we come to the end of this video. I know this video on high blood pressure is a very short one, but I would love to discuss more when I do these genetic testing videos in the future. And if you want to know more on other health related videos, you may want to check out my playlist over here.